So I would love to just pepper you with a million questions.
Go for it. Yeah, fire away.
Okay, so I kind of mentioned, but I'll go through it. So driving home from DC, I was thinking
Yeah,
about, okay, so what are the applications? What are the business models? How are therapists using this right now?
yeah.
And the one that keeps coming out to me that just seems to make the most sense.
You pick the
Do
angle.
you
Wherever you
have
want to record.
people that are taking the hardware, taking the technology, going out on site, like going to a running shoe store, and setting up and either charging the shoe store a day rate or charging per evaluation, and then having like a co-marketing where the therapist and the shoe store say, hey, on October 31st, Tony Maritato, physical therapist, is going to be coming out and we're going to be doing evaluations, and you just book 15-minute slots or whatever it is. Do you have anybody doing that right now?
Yes, and I did that for a long time when we were just getting started, to be honest with you. It was a great way to kind of get established where we would go out to the running store and we would book and we would say, okay, it's $100 a person, and we would book 6 an hour. And we
Yeah.
were making $600 an hour, and people would come in and we'd let them try on different pairs of shoes, and we would do those, and that would be helpful. And we have some running stores that have this, and they use it all day. They're
Right.
like, they crush it with it a lot of times there if they can kind of buy into the model and get people to realize, hey, yeah, for $50 or so, if it's not a skilled provider doing it there, it's a great way just to see what your mechanics look like and compare a couple different pair of shoes. So it can be very effective doing it that way. And then somebody just bought it last month that they are doing it out of a trailer. He built out like a trailer, and he's going to events, and he's got a treadmill in the back of the trailer, and he's just
Yeah.
kind of rolling up to track meets and rolling up to other things and saying, okay, hop on. Let's check out your form. Let's see how it goes.
Right. Yeah, that's exactly one of the things I was thinking about. The other kind of side to this, so I was looking at it and I'm thinking as I talk.
Yeah.
One of the things that we've been talking a lot about is remote therapists. So the
Yeah.
PT is offsite,
Yeah.
but a trained clinician or trained technician on site.
Yeah.
We're looking at this model with other pieces of equipment outside of the walking, running world. And I'm
Yeah.
like, why couldn't I have, a great exercise phys person or somebody else who basically we work a partnership agreement where they go on site to local shoe stores, running shoe stores, but they also do CrossFit boxes and,
Yeah.
other fitness based places. Um, they receive a commission for each of, the setups and breakdown and everything. But then we could also outsource the actual, like, I'm not a running expert. You're a
Right.
running expert. I'm not saying you would do this, but like there's other therapists all around the country where I could say, okay, for this rate, you get the basic assessment. And
Yeah.
then for an add-on, you can have this, is it Christopher Johnson or somebody like that
Yeah.
do the full breakdown analysis and programming for the following 12 weeks,
Yeah.
something like that. Do you have anybody doing anything like that?
Um, no, we have several sites that are using athletic trainers
Right.
to do the evaluation, kind of like the first part of what you were talking about. But there's not been the upsell of like, hey, I can put you remotely in touch with this running expert, and they can look at your data, and you can get some coaching or some personalized programs. You can do those types of things to kind of upsell or add on. For $200 a month, you'll get an expert that's going to look at your data and is going to design a specific program for you. Which is
Yeah.
an interesting idea. We don't, as far as I know, we don't have anybody doing that, but I think it's a good idea.
And if I remember, there is no actual, there's, and I don't know if it's infrared or there's
Right.
the sensor, the
Yes,
reflectors, but is there an actual video like you and I are on video right now? Is there an actual video recording like this?
you can. We tend not to. I'll tell you. So initially, like the system's set up. So if you get any USB high-speed camera and plug it into the software, it's going to pull up the video and take it side by side so that you can see
Yeah.
it. What I found is that this is kind of one of the things we found salespeople on the 3D a little bit is people when they look at the recording of themselves, they tend to focus on how do I look in those shorts? How like what am I? Is that like that's what my running form? And then they see the skeleton, they're like, that's what I'm doing. That's what I feel. And the skeleton is so
Gotcha.
much more impactful. But you can hook up. I mean, I even had a little. We used to give a 60 frame per second
Yeah.
webcam with it, and you can just set that up. Now it's only going to get one view and things like that, but it can give a nice frame of reference if you want. We don't incorporate it into the reports. We used to incorporate it into the reports, but we honestly found people were focusing only on the 3D. And even had some people ask me like, "Can you minimize the video? Like, I don't want to see that. I want to focus on that skinny skeleton person here,
Yeah.
and see what that person can do because that's where I'd like to see myself."
That makes sense. I was thinking for the remote clinician who's not on site,
Right.
it would give them one more piece of information about who the runner is, what they look like, how they're moving. Now, when you guys had it set up, it was only from a behind me view.
Correct.
Is there any reason there's not other views or perspective? And I don't know anything about motion analysis or capture, so you inform me about it.
Yeah, so motion analysis, the way that it works is that all the cameras are getting all planes of motion. It's not like the camera to your side gets sagittal, in front of you gets frontal, and over top of you gets transverse. The way that the technology works is that those cameras are calibrated to know where the other camera is. And then when two of those cameras see a point, they create a triangulation to know where that's going. So the portability aspect of the Helix 3D is because walking and running have a low transverse plane amount of activity. So the markers are easier to visualize. So you only need three cameras in the back so that they get those images. Now, it's not to say that you couldn't have more cameras, but more cameras around only increase the visibility of the markers, but it doesn't add anything additional. If two cameras can see it, then you're fine.
Gotcha. And that device that was behind me that had 2 or 3 cameras in
There's
it?
there's three cameras embedded in that long bar that sit on
Yeah.
top of the tripod. And those three cameras, so basically there's one in the middle that can see almost all of them at any given time. Then the one on the left is going to get more of the left side and the one on the right. So ideally you want the one in the middle and the one on the left are seeing the left side at all times, and the one in the middle and the one on the right are seeing the right. But in reality, the one on the right can see a lot of the ones on the left too. So
Right.
then you get three cameras kind of seeing it. So the more cameras is better, but now you're talking higher dollars
Yeah.
and more sophistication and more opportunities for some things to go wrong.
And how much distance do we need from the subject to the camera to get the best, most accurate information?
We typically tell people to say you want to have about 6 to 7 feet of space behind the treadmill to
Okay.
give you options for varying heights. It's not that you need to always have it all the way back, but having the ability to go back will let you get somebody up to about 6'5" with some of those things. So we typically like running can be closer if you have less space, you can do running closer, and then the camera bar raises up and angles down so that it can see it. With
Okay.
walking, there's the C7 marker, so
Yeah.
you need to have it a little lower and be pointed less of an angle so that you can get the feet and the cervical, like the base of the cervical spine at the same time.
And let's talk about walking because I know you're moving
Yes.
more into that kind of demographic. When I first talked to you, I had said my community is people that have had total knee replacement.
Yes.
Looking at a technology like this, is this something? And I don't remember. am I going to get information about range of motion through the joints, or what information am I getting relative to their walking movements?
Yes. Let me pull. This one might be easier to show than tell here.
Yeah.
Inside the software, there's a lot more data. So in here, what you're going to see is you're going to be able to watch the video. You could say, okay, let's see it. Let's watch what's going on. It's going to give you the overview. It's going to give you some spatio-temporal data so that you can see things like double support time, single support time, step width, all of those things. You'll be able to see that. Cadence, gait speed. I forgot to change gait speed on yours. Yours wasn't 6.2. But then it'll go into some of the data to see here, like stride length. You're going to get some of those other ones. You're going to see a little bit more of where those fall normative. And then we start to see some of the specific angles. So the angle of your hip on the right at initial contact, I see is 21 degrees, and on the left, it's 19. We see the knee flexion, your 3 degrees of hyperextension on the right, 6 degrees of hyperextension on the left, your ankle position. So it goes through and gives you all of these. Now, on the actual software, if you really wanted to get granular, you can go frame by frame and see exactly, and you can say, hey, what's the hip doing at the same time as the knee? And you'll be able to look at that simultaneously and get a lot more analysis in there. But if you're going to send this to the client, or there's like a shareable link here, or if you're going to share this with a referring physician, then they're going to get this just to be able to see it. And then they're going to get the overall emphasis of like, hey, here's what's going on. But then they can look down and be like, all right, well, I just care about the knee at initial contact and the knee flexion at mid stance. Okay, that's pretty good. I like that. So it does give the breakdown of the actual angular positions.
Gotcha. What about recruitment? And we talked about this morning on the PT Breakfast Club podcast.
Yeah.
One of the things that I'm looking at is I want to be able to recruit therapists again. I haven't hired a
Yes.
new therapist in like 15 years. I am 25 years into private practice ownership. Like, as much as I love all of the educational content that you guys have available, it's a
Yeah.
little bit daunting for me to think like, oh man, I'm going back to square one. Like, am I going to go through all this? But I was like,
Yeah.
what if I could use a device like this as a recruitment tool to say, hey, recent grads, new grads, or even therapists looking to pivot into something else.
Yeah.
I've got the money, I've got the equipment. Is this something that I could use as a recruitment tool to bring really the best of the best, like passionate, excited, motivated therapists into my practice who are going to not just submit billable units, but can actually bring a cash,
Service.
offer
Yeah.
into my practice. Have you seen anybody specifically go down that road to
Yes.
say, hey, I'm going to buy this and use it as a recruitment tool to bring in new clinicians?
Recruitment and retention
Right.
as well. There, we've seen that where people have said, "Hey, I want like a go-getter, somebody that's going to invest in it." I think just being open and honest, like some of the challenge with that is like, is there a stipulation of like, you got to work for me for a certain amount of time, or if I'm going to invest in technology and things like that, you kind of have to say, all right, well, you got to work for me for at least a year if we're going to do this type thing. And I think that that's been challenging if you add a stipulation to it. If it's purely like, I just want to, I'm doing this, this is what I want, this, you're going to be my person. And if you don't put the stipulations on it, then you will get somebody and keep somebody, most likely. But that's more of a part of the hiring process. I found that the stipulation has been like, well, I can't. One person tried this, and I asked him, and he was not a PT. He just owned physical therapy clinics as a business person. So he put in non-competes, and they had to work for like 3 years, or else they have to pay back the education, and they have to do all this stuff. And he's like, I can't find anybody. It's like, yeah, PTs are going to hate that. Like they're not going to sign up for that because you can get a job anywhere in the world that you want right now as a PT. So they're not going to want to limit their options.
Yeah.
So that's just what I've found. It can be a very good recruitment tool. I've often thought about like, we should do when somebody buys the equipment, I'd love to email our whole list of education people and be like, hey, this site's bringing it on. They're looking for an employee. Like anybody in the area or looking to relocate, like we'd be happy to do that for somebody. And we thought about that. We might have to like have people opt in to know about jobs or things like that, but offer that as a nice way for just another way to help our partners out that are purchasing the equipment to say, well, we've got all these people that have bought into our system and bought into our education. They're trained on a lot of it. Like, hey, who's around? Who wants to work together here?
Yeah. No, the biggest thing that came out of PPS while I was there was nobody was looking for things to bring more new patients into their practice. Everybody had a wait list or they had plenty of patients. Everyone was, how do I attract more therapists? How do I bring in
Yep.
clinicians? And how do I have the revenue to pay them more?
Mm-hmm.
And so that's where
Yeah.
I look at something like this and I'm like, you take the training,
Yep.
you take the hardware gives you a moat. And that's where
Yep.
I would say, like, from a retention perspective, I totally get what you're saying about, come on board. If I'm going to invest this money, I need you to have a commitment. But at the same time, I'm like, you know what? I still own the hardware. Even if
Right.
they came on and they decided to go somewhere else or, life
Yeah.
happens and they have to leave, I could still attract another clinician
Right.
who wants to go down this road. So I would be less inclined to worry about the
Retention. Yeah.
retention
Yep.
because I think it's an attractive enough offer even to bring people from out of the area. And I've always been the kind to say, I'd rather get an amazing therapist for 6 to 18 months
Yeah.
than an average or below average therapist for 20 years.
Yeah. Because you're setting the bar of like,
Right.
hey, this is what productivity looks like. This is what quality looks like. This is what our clinic looks like.
Let's talk about brand deals. So
Yeah.
one of the things that's been going on for me,
Yeah.
I've been a huge advocate, proponent of saying two things. One, we need to make our clinicians celebrities. We need to build their, personal brand. We need to get them
Yeah.
out there. We need to make people want to come see them. I understand the risk, which goes in line with what we just talked about
Yep.
me investing to build their brand and then they leave and they take that brand with them. But that's part of the game, just
Right.
like in professional sports.
Yes.
Um, but I get a lot of inbound from everything from, fitness equipment to shoes to clothing to whatever.
Yeah.
Having something like this as a way to grow the media side, because it is a very visually appealing form of content that we can produce, the
Yes.
colors, the graphics, the motion analysis, all that stuff, getting young people, athletes into the clinic to, allow me to take videos. And I just shared, I don't know if you saw it last night or this morning, my 15-year-old, 16-year-old now is in cross country. So we
Oh,
did a
nice.
thing with these compression boots,
Yeah.
um, just all that stuff. There's so much
Yes.
available opportunity in sponsorships, partnerships, equity. There are
Yeah.
brands that are willing to give up equity to the right media. Um, what are you seeing on that side?
Um, as far as like what we're doing with people
Are
or
you seeing any of your providers, partners doing any real push into video and other forms of media and creating those relationships with brands, product companies, anything like
yes. Yes, a good example of this is one of our users out in LA. She crushed
Of
it.
course it's LA.
LA, right? But she went out there and she runs her business like she literally came to us at CSM and said, I love this. She bought a Woodway and our system at the same time and started a practice and runs the business exactly how we tell her. Like, she literally even plays videos of me to explain things as opposed to explaining herself, and she runs it by the T. And now she's on an Adidas team that is like, because she did a really good job with social media and getting the word out there, and she got very involved in community groups. She literally is like an Adidas ambassador or something now, because they saw her as like kind of a thought leader and bringing it out there. So it's, one of the benefits of this device is it can be proof of other people's claims. So they say, all right, we've got the best orthotic insert, right? Okay, show me, right? These shoes make you walk better than those other shoes. Great, show me, right? So this is the proof to say, like, do you know Zero Shoes and Steven Sasha? And,
Absolutely. They were there at PPS. I was dying to go talk to him. I've been following him for like 5 years now. He cut
oh,
all his hair off from what I could see when I saw him at PPS, but I
that was
didn't get a chance.
Joe. That's not
Oh,
so Joe is the community relations manager and
oh,
Steven is the owner. So Steven and I were just together in Park City 2 weeks ago, 3 weeks ago,
okay.
I guess now. And he's great, but he couldn't make it out for this one because it was his anniversary.
Uh,
But happy to make a connection too. If there's he's great to talk to. He's great to have on podcasts,
yeah.
things like that. I'm happy to make a connection there.
Awesome.
Yeah, he's great. But that's one where they've come to us and kind of said, hey, like, put somebody in a pair of their regular shoes and put them in a pair of zeros, and we can show how immediately it changes the difference there. So
What
yes, we
kind of
do. Yeah.
changes do you see with something like that? Like let's go extreme to extreme. Let's go
Yes.
Hoka to zero.
Yes.
What would I see on your motion analysis?
You would be able to say, so if you're just checking walking, because I just had a long meeting actually, we're updating running to look the same as walking. So that's underway where like people love the score, they love the new visuals. We're doing the same thing. So that's in process now. But for, let's say you're just walking in it. If you have somebody that's total knee replacement, they put the Hokas on and they're like, hey, I think you should get these zeros. Okay. You put them in them and you'll see immediate change in the score. Like it literally a lot of times, sometimes cuts in half just by people walking with better mechanics that way. But then you'll be able to specifically look at things like, hey, their pronation went down from 9 degrees in the Hoka to 3 degrees in the zeros. Their ankle plantar flexion at heel rise went from 6 degrees to 15 degrees there. It will show you like joint by joint all the things that change and how they can do that. You can look at symmetry, right? So you could see, hey, your cadence went up by 10%, your ground contact time became much more symmetrical, your duty factor improved, your double limb support, like all of these factors you can quantify and say, hey, and we even have like comparison reports. So actually, I'll show you on yours. I think I'll show you how to do this on yours. Because yeah, we did two with you. You see my screen now?
Yeah.
So you can just add to compare, and then when you hit compare here, now you're going to see it's going to bring up an analysis for you where you can look at and put side by side. So you can name
Okay.
these like Hoka and Zero.
Yeah.
And or like if you're working with a modality group, or if you're working with an exercise group that says like, oh, I know how to increase everyone's glute strength. You could be like pre glute strength, post glute strength. And then you could be
Right.
able to show, hey, look, like, these improved, these all improved. This is a lot better here, right? We see some definitely improvements there. And then you can see, hey, cadence went down, stride length went down a little bit. Like it'll show you the differences so that you can see and quantify. But you notice this report, how much more symmetrical things are versus the other report. We saw some bigger differences there.
Yeah. And really, I mean, the truth is,
Yeah.
if you're not vested in any particular shoe brand, it's I don't care what you like. If the
Yeah.
Hokas were better, then go with the Hokas.
Right.
It's
Yeah.
whatever is best for you. Um, that's
Yes.
awesome. Let me
It's,
ask you the
yeah.
normative data that you guys are using. So like if I was going not necessarily to a population of people that have had knee replacement, but maybe just a population of individuals dealing with some gait abnormalities, some residual effects either from a
Yes.
stroke or from Parkinson's or things like that.
Yeah.
Am I going to get useful information for that population?
Absolutely. Now, the expectation for their score is going to be dramatically different.
Yeah.
But that's what we're establishing now, and that's what universities are starting to publish and to look into. They're looking at to say, okay, we have a normative database, we have some of these things, but what's the expectation for somebody with Parkinson's? What's the expectation for somebody that's post CVA? What's the expectation for somebody that's a unilateral knee replacement versus a bilateral knee replacement? Like, what we're getting some of those scores, and it's early, so I'm excited to get that. It's like a career's worth of work, kind of figuring out like all these different things. Like, we created this great thing, and now like I just want to keep getting data and keep understanding everything, because it's like we de-identify everything and pull it all together ourselves. So our database is growing bigger and bigger and bigger, and that's what we're doing with running now, because we had thousands of running files. So to
Wow.
build the running algorithm, I don't even have to collect any data. I've got thousands of files from the top runners in the world to first timers that have never run a step in their life. So we have all that data that we can see and kind of create it. So you would get a ton of information for those populations. And the nice part of it, like I have this big soapbox that I go on with physical therapists, is that we do a great job and don't tell anybody about it.
For
And
sure.
better than telling, we need to show them. So
Right.
if you can take somebody that's a post-total knee or a Parkinson's patient, and if they're a 55 for their score, and if you bring them down to a 25, you're like, you're doing so much better. Like I am, like you set a benchmark and you motivate them. That is huge. That like that gets them intrinsically motivated, and it makes your ability to get them to the end point even quicker and better results with it. So that's my, like, we have to be doing test-retest. If the whole profession did one thing every single patient multiple times every single treatment, test-retest would be the answer that would accelerate our profession significantly, if we're just willing to look and say, am I actually making improvements here?
Yeah, makes sense. The other one I was thinking when you talked about test retest, we talked about shoes and different shoe brands. I
Yeah.
was thinking about other specific interventions. Now, again, I am totally ignorant to this, but one of the things that's been on my radar is therapists are using different
Mhm.
shockwave machines and
Yep.
tendinopathy treatments with it. And I'm just like, again, that's one of those things where if we did the test, shockwave treatment to reduce subjective complaint, and then
Yep.
retest to see how it changes just within a 20-minute period.
Yep.
Just more opportunity. And then, of course, the technology is fancy and shiny, and it brings people in,
Yeah.
that we could then go back to doing the basics. I'm
Right.
a very basics oriented kind of therapist.
Yes. Well, doing the basics well and knowing when to apply them is expertise.
Yeah, 100%. Last question that I had, and this is totally off the radar. Do you have anybody doing any pre-employment screening type of assessments?
No, but we have had recently, with the addition of walking, the executive physical companies have started to reach out to us. So
Okay.
they're starting to say, as part of like their executive physical, saying, what's your walking look like? How likely are you to have musculoskeletal type injuries?
Yeah.
They are looking at that. And it's along those same lines that
Yeah.
you could, say, hey, pre-employment, if you're at Amazon and you're going to have to walk 4 miles a day, we might want to make sure that your score is 10 or less, to make sure that you're not going to get some type of injury that we're going to have to pay a lot of expense for. So it could be a pre-employment. Now, on the flip side of that, did we talk about the military?
No, let's talk about it.
So the Department of Defense, specifically the Air Force, is looking at putting this at every single recruitment center. because they're paying a lot of money for preventable injuries that are happening at basic military training.
Uh-huh.
And therefore, if we can identify those and rectify those before somebody goes to basic training, it will save them millions, hundreds of
Yeah.
millions of dollars a year. And so that group, because we did a study with the Air Force where we had like 87 people go through, and we just literally gave them just whatever the algorithm said, that's what they got for a program. There was an average of a 90-second improvement on the physical fitness test and no reported injuries versus a 60% injury rate for a comparison group.
Wow.
Now, unfortunately, we can't publish that study because of Department of Defense. But it's like it really is showing that for that same kind of line, you can do a lot with it.
Yeah. Man. Okay.
Everyone walks, right? Like,
Yeah,
and
yeah.
it's one of those things that we're just not measuring for some reason.
Right.
And understanding how people are walking and addressing that, it's that critical piece. And another small soapbox is like, I'm all for the basics as well, just like you. But I also want to utilize the technology and things that are going to help me to do the basics better and to know when to do it and to put it together. And I think we need to be showcasing our abilities. Like when you look at the chiropractors and the orthopedic surgeons, they're not making their profession simpler.
Right.
They're tightening the moat, like you said. They're building a bigger moat around it by increasing their capabilities and making them the experts and adding technology and doing things that are like, oh, wow, that sounds great. Like maybe that'll help me out too.
Yeah.
And I think our profession needs to do the same thing. Like we need to lock it down and say, hey, yeah, if we're the movement experts, great. Let's lock down motion analysis. Let's show everyone that this is where you learn to move. And let's be willing to show it.
And I think you could do it in a very like reasonable, practical way,
Yep.
because I always say, like, I get the question all the time, well, what's the difference between you and YouTube? Like I can go to YouTube and see how to treat a low back,
Yeah.
You're right. You kind of can.
Yeah.
But it doesn't have the analysis. It doesn't have the background and understanding all of the aspects of what might be contributing to the condition you're dealing with.
Yeah.
And just sometimes having this kind of technology at your availability just gives you that competitive moat that shows that, okay, you're different, even if at the end of the day, it all goes back to eat better, sleep better, move a
Yes.
little better, the
Yeah.
fundamentals of human life. Let me ask you though, this will be the last question. Let me ask you from a practical perspective, how do you reconcile kind of in your head, okay, so I see this movement difference in a person, and I'm using
Yeah.
those words intentionally. That doesn't necessarily mean that because this person is moving in this way, that this person is, that is driving the pain, or this
Right.
patient is asymptomatic, but they're moving in a way that's different from, let's say, the norms. How do you kind of bring, these two ideas together where pain can be completely separate from what we see in mechanics
Yep.
and vice versa? What's your position on that, or how do you communicate that to somebody?
Yes. So, I'll give you a running example first, right? If we can reduce the stress of each step by 10%, we can run twice as far before the body breaks down. So there is this, like a little bit goes a long way. And now the inverse of that is also true. Imagine you're increasing the stress by 10%. You're much more likely to get injured at the same point. So while there is no perfect way to run, or there is no perfect way to walk, there are things that we know contribute and have seen in the literature that contribute to risk of injury, risk of falls, balance issues. Like we know that there are certain things that people do that will contribute to potential injuries or illness there, and we need to address those things and get ahead of those. Because how many times have you had somebody come to you and say, I don't know why I developed back pain? And you say, well, if I could have talked to you 30 years ago when you first started telling everybody that you've got really tight hips, and all of a sudden you started extending at the lumbar spine when you started walking instead of extending your hip, then if I had seen you then, I probably could have given you a lot better answer and been
Right.
able to show it. But you've got a 30-year history of compensations that we need to figure it out. So Gait is one part of it. We have to look at the whole picture. And that's why in our courses, we have the Gait capacity screen, we have the runner readiness assessment. You have to be able to take that picture. And that's the difference of getting a YouTube assessment versus working with Tony, right? Tony's going to go in there and say, hey, you know what I'm seeing? Your your hip was really tight on that Thomas test. You're going into excessive trunk extension at terminal stance, and you're getting some low back pain. I'm going to address these. I'm going to retest it and see if that makes a difference. And that's what we're going to focus on. And that's what
Yeah.
we're going to do, that you'll never be able to personalize the recommendations the way that you can with advanced technologies like this and advanced skill sets.
And I think it's reasonable to say, look, we're going to try the intervention that's most likely to work. And
Right.
if it doesn't, if somebody comes in and they're doing worse, doing what
Yeah.
we thought would have gotten them better, then we're going to pivot and we're going to change and we're going to go to something else.
Yeah.
We're going to eliminate the dogma of this is what you do every single time with every single person.
Yes.
This is just a way to give us more information to make a more informed decision, but the decision is always going to be based on performance and the response in the person.
Exactly. And if you're doing test-retest consistently, you're going to be able to measure and see if you're on the right path. And it's not going to take you 3 months or, 3 times a week for 4 weeks kind of thing to
Right.
figure it out. You're going to figure it out in 1 or 2 sessions. And that's
Awesome.
like incorporating this stuff makes a huge difference with it.
Yeah. So I know we're recording this on your end. I'm hoping you're going to
Yes.
send me this video.
Yep.
For
I'll
people
send it
that
to you.
watch it. What is the best way for people to get in touch with you? You said LinkedIn, but website, LinkedIn, what do you prefer?
Yeah, so I'm probably old-fashioned, more along the lines of email, actually.
Yeah.
There, Doug at rundna.com is normally the best way to get actually a hold of me there. But checking out rundna.com is a great way to see about that. We have a lot of things. There's a podcast on there. There's tons of blogs. There's resources. You can find out about the education courses. There's a free Essential Elements course that gets people introduced to our systematic approach to working with runners. So that's probably the best place is rundna.com, or just email Doug at rundna.com, and that's probably the best way.
And you guys have the hardware. You have the
Yes.
education. Do you have a certification?
Yes. So it's certified running gait analyst and certified walking gait analyst. Running has level 1 and level 2. Walking has level 1, and level 2 is already the content's pretty much created. It's just I gotta film the course and do all the work that goes into putting it out there and in the ether there.
Are there requirements, minimum threshold? Do you have to be a physical therapist to do it? Who can do it?
We actually get a lot of people even that are just really curious about their own self and saying, hey, I'm just curious about my own running or my own walking, and I want to understand a little bit more about the biomechanics. And that's why we say the free one, the essential elements of running, that's a great one just to kind of say, hey, I'm going to understand range of motion and muscle activity with running, and I'm going to get introduced to the 5 categories of running gait. And that's going to be a way that we can just take that information and see, hey, do I want to go further? And we even have like an endurance running coaching course. That's a great way for any self-coach runners. But we get a lot of even non-medical or fitness professionals, just even recreational people that are curious just to be more informed.
Awesome. Well, whenever you want, go ahead and end this recording, but
There
don't
you
get
go.
off the call yet.